Hello, I'm WWE superstar Titus O'Neil, and today I'm coming to you as a neighbor. You owe it to yourself and those you love to get tested now. Get the care you need and protect your family. Hillsborough County is offering free coronavirus testing and no health insurance is needed. It costs you nothing to get tested. Visit hcflgov.net/staysafe for more information and have a reservation made today. Share this with a neighbor, and let's come together as a community and keep fighting to get through this. Together, we will come back stronger. God bless.
Hillsborough County leaders, along with state and local health and safety partners, are urging residents to be vigilant and stay safe as the county continues to reopen. Aligning with Governor Ron DeSantis' safe, smart, step-by-step plan, establishments like restaurants, bars, gyms, sports venues, movie theaters, amusement parks, and tattoo parlors may resume operations with some restrictions. To help protect yourself, your family, and others from getting or spreading the COVID-19 coronavirus, you should avoid crowds larger than 50 people and continue practicing social distancing. If you're around others, keep 6 feet between you when possible and avoid hugs and handshakes. Why? Health experts say the virus is thought to spread mainly from person to person. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. Residents are urged to wear cloth face coverings in public places. You could spread COVID-19 to others even if you don't feel sick. The face cover is meant to protect other people in case you're infected. Medical grade masks are not needed for the general public and should be reserved for healthcare professionals. Continue to wash your hands often for at least 20 seconds, clean frequently touched surfaces daily, and try to avoid touching your eyes, nose, and mouth. Stay home and avoid public places if you're feeling sick. COVID-19 tests are available to any Hillsborough County resident, even if you aren't experiencing symptoms. They are free, no insurance is required, but you must call and schedule an appointment. Visit hcflgov.net/staysafe for more on reopening information along with COVID-19 health and safety tips.
Hi, I'm Hillsborough County Commissioner Les Miller. We're going through an unprecedented crisis as we navigate the COVID-19 pandemic. I understand your challenges, and I'm sympathize with the difficulties many of you are facing during this time. Hurricane season started on June 1st. It is important that you plan, prepare, and stay safe. This year, experts are predicting 40% more storm activity than a typical hurricane season. When a storm is identified, it's important to stay tuned to your radio or television and listen to local authorities. Stock your home and vehicle with emergency supplies and make plans in advance to protect people with special needs and pets. If evacuation orders are called, heed the warnings and follow special instructions related to sheltering during COVID-19 pandemic. I encourage you to visit hcflgov.net/staysafe for information on disaster planning, evacuation zones, shelters, and more. Make sure you and your family plan, prepare, and stay safe.
This is a battle we've never faced in my lifetime. I want to tell you about 416 of the most amazing people. Every day I get to see their skill, professionalism, and dedication. Their commitment to protect and improve the health of everyone in Hillsborough County. The last 2 months, they've been on the front line of a battle with a very dangerous enemy, COVID-19. And they've risen to the challenge in the most amazing, heroic way. Everyone has contributed, sacrificing their personal life, which they put on hold. They're making a difference for everyone they help, and every day I get stopped and told just how amazing they are. I'm proud and blessed to work with them, my second family.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/staysafe for up-to-date information and tips.
This is Dave. Dave doesn't know his home's flood zone and was not able to heed flood warnings. Dave and his home are soaked. This is Noah. Noah is an informed citizen. He was warned in advance about potential flooding in his area. Noah took precautions. Noah is dry.
And I saved the animals too.
Good job, Noah. When it comes to flood warnings, be like Noah, not like Dave. For more information, visit hcflgov.net. Be safe, be informed, know your flood zone.
Hello, I'm WWE superstar Titus O'Neil, and today I'm coming to you as a neighbor. You owe it to yourself and those you love to get tested now. Get the care you need and protect your family. Hillsborough County is offering free coronavirus testing and no health insurance is needed. It costs you nothing to get tested. Visit hcflgov.net/staysafe for more information and have a reservation made today. Share this with a neighbor, and let's come together as a community and keep fighting to get through this. Together, we will come back stronger. God bless.
Hillsborough County leaders, along with state and local health and safety partners, are urging residents to be vigilant and stay safe as the county continues to reopen. Aligning with Governor Ron DeSantis' safe, smart, step-by-step plan, establishments like restaurants, bars, gyms, sports venues, movie theaters, amusement parks, and tattoo parlors may resume operations with some restrictions. To help protect yourself, your family, and others from getting or spreading the COVID-19 coronavirus, you should avoid crowds larger than 50 people and continue practicing social distancing. If you're around others, keep 6 feet between you when possible and avoid hugs and handshakes. Why? Health experts say the virus is thought to spread mainly from person to person. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain contain the virus. Residents are urged to wear cloth face coverings in public places. You could spread COVID-19 to others even if you don't feel sick. The face cover is meant to protect other people in case you're infected. Medical-grade masks are not needed for the general public and should be reserved for healthcare professionals. Continue to wash your hands often for at least 20 seconds, clean frequently touched surfaces daily, and try to avoid touching your eyes, nose, and mouth. Stay home and avoid public places if you're feeling sick. COVID-19 tests are available to any Hillsborough County resident, even if you aren't experiencing symptoms. They are free, no insurance is required, but you must call and schedule an appointment. Visit hcflgov.net/stay-safe for more on reopening information along with COVID-19 health and safety tips.
Hi, I'm Hillsborough County Commissioner Les Miller. We're going through an unprecedented crisis as we navigate the COVID-19 pandemic. I understand your challenges, and I'm sympathize with the difficulties many of you are facing during this time. Hurricane season started on June 1st. It is important that you plan, prepare, and stay safe. This year, experts are predicting 40% more storm activity than a typical hurricane season. When a storm is identified, it's important to stay tuned to your radio or television and listen to local authorities. Stock your home and vehicle with emergency supplies and make plans in advance to protect people with special needs and pets. If evacuation orders are called, heed the warnings and follow special instructions related to sheltering during COVID-19 pandemic. I encourage you to visit hcflgov.net/stay-safe for information on disaster planning, evacuation zones, shelters, and more. Make sure you and your family plan, prepare, and stay safe.
This is a battle we've never faced in my lifetime. I want to tell you about 416 of the most amazing people. Every day I get to see their skill, professionalism, and dedication. Their commitment to protect and improve the health of everyone in Hillsborough County. The last 2 months, they've been on the front line of a battle with a very dangerous enemy, COVID-19. And they've risen to the challenge in the most amazing, heroic way. Everyone has contributed, sacrificing their personal life, which they put on hold. They're making a difference for everyone they help, and every day I get stopped and told just how amazing they are. I'm proud and blessed to work with them, my second family.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles.
This is Dave. Dave doesn't know his home's flood zone and was not able to heed flood warnings. Dave
Castic.
Here.
Ross.
Here.
Chronistick.
Here.
Kniveley.
Here.
Merrill.
That's Wise. Wise are taking the place.
I'm
Ms.
here.
Wise. Thank you. You have a quorum.
Thank you. We're now moving to public comment. We've set aside 20 minutes for public comment. Each speaker will have 2 minutes to speak. The first speaker is Paul Thompson.
Hi, how are you?
Good.
So yeah, this is Paul Thompson. First of all, thank you very much for having me. I want to thank you all for your efforts during this challenging time. I know you're all doing the best that you can. Most importantly, last week a caller proposed an amendment to raise the age requirement for wearing a mask, and I just wanted to re-raise that. I know it wasn't possible last week due to some procedures and needing to wait the 7 days, but if we could please re-raise that at today's meeting, I definitely think that's important. Preschool kids should not be forced to wear a mask. I believe Mayor Lott suggested 8 years old. I'll let you decide what. Not let you decide. I'll have you decide what age you feel is most appropriate. But if we could try to push that through today, that would be great. My son is 4, and it's very, very challenging to get him to wear a mask. I also want to talk a little bit about what success looks like as far as when we might roll this back. I understand the need to put them on now. I don't entirely agree with it, but I can see the need. But we need to define what success looks like as far as rolling it back. We locked down the economy to protect hospital capacity, and hospital capacity is available online. I've been monitoring it. We're in no danger at this point. I'm not saying that we might not see in the future show some challenges to hospital capacity, but I think we need to figure out what the criteria is for rolling this back. If we're 3, 4, 5 weeks into wearing the masks and we see no challenge to hospital capacity and no increase in the death rate, at that point, I think we really need to start thinking about rolling this back versus just looking purely at the number of cases. I don't think that the number of cases is really reflective of where we are now, given that the situation is very different. I also wanted to just thank Mayor Lott. I know, Mayor Lott, that your opinions may sometimes be in the minority, but many of us appreciate your measured, thoughtful, and reasonable approach to looking at this holistically. So thank you very much for that, and thank you all for all of your.
Thank you. Deborah Farmer.
Commissioner, this is Glenn with Communications. Deborah has dropped from the call.
Okay, thank you. Leslie Forrester.
Hello, my name is Leslie Forrester, and I am a resident and business owner here in Hillsborough County. I would like to encourage the EPG to protect the health of our population by continuing and strengthening the mask ordinance and taking further additional measures to lessen the spread of COVID-19. We are one of the top 4 effective counties in the highest surging state in the nation, and we need to act like it. Do not let the July 4th holiday come and go without strong responses that are based on science, not politics. Seeing over 4,300 new cases in our county over the last week, it is obvious COVID-19 is an increasing health threat to the health and safety of the community. I encourage the EPG to speak with the health experts about transmission vectors, especially what we have learned about droplet transmission and aerosol transmission, the dangers of indoor gatherings, poor ventilation, and length of time of exposure. Please consider this information in your recommendations and mandates. Yes, masks in businesses are necessary and should be joined by limiting other vectors for super spreader places and behavior. Consider rolling back the opening of dine-in restaurants to only outdoor seating and carryout, and limiting non-essential retail businesses to curbside. Indoor, long, close contact personal services such as hair salons, massage therapy and spa services, tattoos, these are not essential and should not be open during a spiking pandemic, which is so often present in pre-symptomatic and asymptomatic populations. I believe that even while owning one such business, and I will do what is necessary for the safety of my clients, even if I personally have to sacrifice, lose business, and dip into savings. Our responses to the virus will shape the health of our population and economy, not just now in the short term, but long term. Hospitalizations lag behind, but they are coming, and deaths are the last indicator to catch up. There was a time when people in this country did what was necessary for us.
Ms. Forster, your 2 minutes are up. Thank you very much. Thank you, Ms. Forster.
Thank you.
Thank you. Chris Ann Hall.
Thank you. Thank you. I'd like every commissioner and member of the EPG that can hear me right now to say aye. Chairman Miller and Attorney Beck, please listen to what I have to say. Public comment is not so we can breathe our complaints into some abyss. It is so we can address this committee and have our grievances redressed. For weeks now, this committee has fluffed off the concerns of those who actually take the time and effort to call in, and this must change. We ask questions, we want answers, but they're never addressed during the meetings. So many people with so many issues, and we are ignored as if this committee is just simply checking a box. I want an answer as to why this committee is responding irrationally to the increased positive test results. When Dr. Holt and his experts said on April 20th that globally there's a high probability of false positive results with these tests. I also want to know why this group is allowing the data to conflate testing positive with increased sickness, and it's just simply not the facts. I want an answer as to why Dr. Holt continues to present one side of the medical field regarding COVID testing and prevention, ignoring a vast number of medical experts that disagree with this information. I want answers as to why this committee is ignoring globally and nationally recognized medical professionals when they say masks on asymptomatic people are useless and dangerous, and that asymptomatic people do not even spread COVID. I want to know when this overtly biased presentation information will stop. We have been patient, we have been tolerant, but we are reaching a critical point once again where our personal liberties, our personal privacy, and our economy are at risk. As a constitutional attorney, I know our rights, and I know the duty of this committee to redress the grievances of the people. If you're not going to respond to us now, we'll have no choice but to demand a response in an alternative.
Thank you very much. Your time is up.
Please
Thank you very much.
yourselves accordingly.
Thank you. Was that our last speaker that had called in?
Yes,
Hello?
sir.
That was it?
Yes, Commissioner, that was, yes.
Okay. All right. Thank you very much. Now moving to emergency management update, Mr. Dudley.
Good afternoon. We'll get you loaded up here.
Good afternoon, Mr. Dudley.
All right. We continue to support in-home testing and operations at remote collection sites, Raymond James, Lee Davis, South Shore, Plant City, Brandon, Waimama, and Sun City. Testing conducted last week, 5,782. Total tests since the beginning of the operation were over 38,000. We had 4,475 appointments scheduled for last week. We have 7,136 appointments scheduled for this week. And we continue to monitor our appointments. We've had a significant increase in demand for appointments. Just wanted to remind everyone that even though we've made the adjustments for the appointments are tied to the number of collection kits that we have available. And the collection kits are tied to the level of protective equipment that we have available to conduct those tests. And then also we have to have the staffing, which consists of volunteers here in our medical community, their availability to conduct these tests. We continue to coordinate with our local laboratories and state for test kits availability. We've been able to meet the demand for PPE coordinating through the state. Raymond James is currently on track for transitioning to the state collection teams starting tomorrow. Friday was the last day for healthcare teams at Raymond James. I would like to thank the 4 healthcare providers for their support over the past 14 weeks, testing over 14,000 people, All of those teams were volunteers working the collection sites as well as working their jobs back at the hospital as well. Advent Health teams are transitioning out of the Waimama collection site, and TransCare teams will take over after next week. TransCare is also currently supporting Sun City and mobile testing. USF medical teams are currently supporting Lee Davis, South Shore, and Plant City. Brandon at the Brandon site, that's being supported by Suncoast Health Center. Logistics, we continue to push PPE out to the community at any critical facility. Throughout the weekend and through this week, we continue to distribute face masks at E.G. Simmons Park, Lake Park, Lithia Springs Park, and the Upper Tampa Bay Park, and also working with our community partners and also the local cities, municipalities as well. We have 1 guest in the quarantine site, 18 guests in the isolation site. Are there any questions?
Mr. Dudley, hold on. Commissioner Overman, you recognize.
Thank you, Chair, and thank you, Mr. Dudley, for your report. It sounds like we are getting a good representation of people taking a test, but if our target is 20 to 50 a day, we're about half of our goal, if I'm not mistaken. On the previous slide, you showed about 7,500, something like that. I'm sorry, 57. Is that due to the lack of testing supplies, available appointment, testers, or the lack of demand? Because I'm getting emails left and right about people saying, I can't get an appointment until July 9th.
We're currently, this is just a snapshot of the county collection sites, and also with the update for the online ability to schedule, as well as being able to call in. That online has allowed us to project further out. Right now, the collection kit, there's a tremendous demand. As you remember early on, we had this demand, the demand versus the availability of the collection kits. As you know, the state, they're partnering with us here, as well as Pinellas County and other various counties throughout the state. So we're working with the state as well as our local laboratories to bring in as many collection kits as we can to meet that demand. So we have partners throughout there, the healthcare facilities. They also offer testing throughout the community. So this is just a snapshot of what the county is able to do in doing our part. You'll get that overall look with the healthcare facilities as we go into Dr. Holt's briefing.
Okay, because your chart does show a drop in daily tests collected on the 24th or 5th, it looks like. Is that accurate? That's just one of the, where we finished up, where you have like the smaller sites. So on the Monday, Wednesday days, I have more sites open, and that's where you'll see that surge of more collections. So with the Raymond James partnering with the state, we'll put 1,000 in, and we're running that 5 days a week, and then the weekend is also included in that. Okay, so are we looking to replace 1-for-1, or are we adding personnel for testing?
We are replacing 1-for-1. The healthcare teams that's been out there since March, they're transitioning back to their hospital duties. So the state is going to bring a fresh new team in to meet this new demand.
Great. Thank you very much, sir. I appreciate all that you're doing.
Thank you.
Mayor Lott, you recognize.
Thank you, Mr. Chairman. Mr. Dudley, a couple of things I want to thank you on is the testing sites that I've witnessed running very efficiently, and I'm getting nothing but positive results from everyone. So I want to thank you for the hard work with all the different organizations it takes to pull that off. The masks that you supplied us with last week, I know you showed how all the cities and the county and the school board received those masks. Those have been a warm welcome, and I think everyone's working hard to get that out into the community, and communities embrace that very well. I had a question, though. when we look at the 1,046 for walk-ups, are those numbers, is that separate, or are those the walk-ups that show up without an appointment, for instance, when they go to one of the locations? Can you explain that 1,046 for me a little bit?
Yes, those are the folks showing up without appointments. We've had that increased demand. So these are the folks that could not or didn't try to get an appointment. This is how we're capturing that increase.
So all those numbers there would be increased by some of those 1,046 in all those different areas then, because I'm sure we're getting some walk-ups just about everywhere, I would believe.
Correct. All our sites are experiencing an increase in walk-ups.
Okay. On top of what Commissioner Overman said, I know that some of the locations have more days than others. Are we looking at increasing all the locations or one of the locations to 5 days a week so that we can hit the objective goal of the 2,250 a day?
So as I brief that, our ability to meet the demand and capacity are all tied together.
Okay.
Current personnel that we have out there right now, they are volunteers from other healthcare, like we have the USF medical teams. So we're basing that availability in those days based on those volunteers' availability.
So the reason why we don't have additional days in some of these locations, I'm assuming from that comment then that's because we need additional volunteers. Is that accurate?
We would need additional volunteers, as well as we would have to stay consistent with our supplies to get enough testing kits in as well.
Okay.
So they're all tied together. You continue to open sites that continue to draw on PPE, continue to draw on volunteer hours, or continue to draw on testing kits. So it's a fine balancing act to keep the testing machine going. And that's why we're relying on partners out in the community as well to help us meet these numbers overall.
Okay. Well, as you notice, I think you're doing a phenomenal job, and I'm not sure if this is a long-term need, and maybe the county administrator can speak on this. But the individuals I'm talking to, when they're calling in for that appointment, one reason why they're, and we're telling them to walk up, okay, because they can't wait 3 or 4 days to take the test because someone that they were around, or there's a significant reason why they're believing that they should be tested. And so I think those walk-ups are occurring because they don't want to wait from a Monday to a Thursday or a Wednesday or so forth. They want to find a location they can get to that can test them that particular day. So hopefully we can give our citizens maybe additional days at the same locations, but to have to wait 3 or 4 days to take a test. I know everyone doesn't have to do that, but in doing so, I think that's counterproductive, where that individual, the 3 days or 4 days they wait, they could be out infecting someone, which is obviously the reverse of what we're wanting to occur. So again, I praise the job you're doing, but I hope we have the ability to get more PPE, more testing kits, and more volunteers to be able to man these sites, because it looks to me from the data that we could use additional days at the existing sites. Thank you very much.
Yes, sir. While I appreciate that, we do continue to ask that you schedule an appointment for everyone we send there without an appointment. For the folks that do have an appointment, you're pushing them back and stepping on those folks that schedule the appointment. Also, and as they're concerned, if they believe they've been exposed and they have concerns about waiting, we ask that that we had that original messaging where you're at home and not out and about if you believe you have some concerns that you've been possibly exposed. So we're going to try to support all those efforts, but we would ask folks to make those appointments.
Commissioner Overman, you recognize. Mr. Dudley, let me get a clarification here. Besides Raymond James right now, Wimauma, Sun City, Brandon, Plant City, South Shore, Lee Davis, those are all volunteers that we have taken that give the test at this point, and the mobile unit.
That is correct. Aside from the mobile unit and Wimauma and Sun City, that's TransCare. That's an ambulance service provider. All the other sites besides Raymond James, they're volunteers. And also, we're increasing Raymond James Raymond James will go to 1,000 a day. That'll give us another 5,000 per week. So they're bringing in quite a bit of capacity for that for us.
And I understand Mayor Lott's concern that people are calling in and they're not able to get an appointment for 3 or 4 days. But I do understand that when you have a walk-up, just like you said, that pushes a person with an appointment back a little further. Maybe even to the point that they might have an appointment that particular day. If it's later on that afternoon and we have number of walk-ups, they're without a test. That's a possibility of I think what might happen if what I'm hearing what you're saying is correct. Also, this also depends on how many test kits we have and how much PPE we have for those people that are working out there. Am I correct?
That is correct. So we're constantly monitoring our PPE levels, our test kits that we have on hand, and the volunteers for those sites. So we've been managing that demand thus far, but we are limited. You're going to be limited by test kits or PPE one way or the other.
And the one thing I don't think we would like to do or want to do is what happened in Pinellas County this morning. They have a system over there with no appointments, and in an hour they were done. They ran out. And we're over here in Hillsborough County, even though we're getting some complaints about our appointment system, and I you to be commended of how we're being able to have so many people take this test at the locations that we have. We have expanded our locations. And yeah, you're going to have some people that may be upset that they don't have an appointment if they feel that they've got to have a test right away. There are other scenarios that they could adhere to. Am I right, Mr. Dudley?
That's correct. We're currently running 6 days a week now. We have a site open every day for 6 days a week.
Okay. Thank you, sir. Commissioner Merman, you recognize.
Thank you, Mr. Chair. This is just a quick question, and maybe Mr. Early can answer this. I thought that some of the sites down in South County were manned by it was either the Tampa Family Health Center or something like that. Are those volunteers?
The Brandon site, that is run by the Suncoast Health Center.
Okay.
So Lee Davis, South Shore, Plant City, those are volunteers.
Okay. Well, maybe we need to start partnering with Suncoast and Tampa Family Health Center to get more help at some of these sites, and then it won't burden when we have to schedule more appointments. Just my thoughts. But I mean, Tim, you're doing a great job. And I know I talked to Gene early about opening a site up in Northwest, and he, I think, is able to get that going with the Tampa Family Health Center people. It wouldn't burden us any further. But I think you've done a great job. I mean, clearly this wasn't a playbook that you had. So, you've handled the burden very well. Thanks.
Thank you. The team is doing an excellent job. And you mentioned the Suncoast Health Center and the Tampa Family Health Center. Even as you bring those centers online, the county, again, we're providing that PPE and test kits. So as you continue to bring those resources online, we would still have to provide that resource.
Gotcha. Okay. Thank you.
Ms. Nyby, you recognize.
Thank you, Mr. Chair. And yes, I echo the sentiments of Commissioner Merman in the fact that you're doing a great job under the circumstances. And so I just had a couple of questions. I know Mayor Lott had expressed a concern about the wait time in getting a test. And constituents that have contacted me are saying that it's actually a little bit longer. I had one contact me on Saturday. The earliest she could get in to take a test was July the 9th was the first available date. So I'm concerned that folks are having to really wait even more than 3 or 4 days. You're looking at 7 to 10 days to even get in to take the test, and then of course the turnaround. I don't know what the turnaround time is these days. It was 3 to 5 days. If it's still that, or if it's more like 7 to 10 days because of the lab availability to analyze the test. Do you have some insight to that, Mr. Dudley, at all?
As far as the turnaround time?
Mm-hmm. As far as the length of time to make an appointment, not to actually be on the phone, but to wait for an appointment, is it it's 9 to 10 days, I guess. Is that average,
right.
or was that an anomaly, or what's the statistic on that?
Right now, we have started that new online scheduling, so we're able to project. We're able to take a look at our testing supplies and then project an appointment tied to that collection kit. So we are scheduled out. We're scheduled well into next week. The demand has been tremendous, but the team has been able to pivot and bring new resources online to collect those tests. So we're going to continue to test, and I think with the state coming on, they're going to continue to look at the demand. We got that 1,000 a day. We're testing 6 days a week, and we've been able to reduce those inability to get through the call center. So the team's done a great job bringing that online.
Yeah, we're pretty happy to hear about the online portal that folks can now make an appointment. And is the turnaround time to get results still 3 to 5 days, or is it a little bit longer now that labs are backed up?
We're seeing some improvements. It could be up to 10 days in some circumstances. Some tests do come back inconclusive, and then we have to recontact those individuals as you've had those same calls. I have to have my teams track that down. So every now and then, some of those tests will come back inconclusive. So that's where that up to 10 days, but you could possibly see that much earlier if there's no issues with testing.
Thank you. And then the last question I have is for folks that call in or click in, are we providing them any alternate solutions if they don't want to wait that long? If let's say, I call today and the first available appointment is July the 10th or 11th, and I don't want to wait, are we telling or giving any resources to those people who call in that don't want to wait that long to be tested as to what other ways that they can get tested, like LabCorp's, Pixel in-home tests that can be ordered online through your insurance, or you can pay for it and it comes a lot maybe faster than we can do it through the county? I mean, what are we offering folks that want to get tested but don't want to wait 9 or 10 days?
If folks want to visit our Stay Safe webpage, our communications department, any of the additional available resources that we are aware of, we keep all of those listed on our Hillsborough County Stay Safe webpage. So please visit that webpage and take a look at the sites that we have available, as well as any other additional resource in the community. So this is a community effort. Again, the county is picking up this load here as well, but we heavily rely on our volunteers, our partners, and we're going to continue to try to meet this demand, and we're going to continue to work with the state as well. Again, we're just appreciative that we're able to add an additional 1,000 kits a day and adding up to 6 days a week.
That's fantastic. Thank you for the update, and I'm glad to hear that there's possible continuing expansion of testing location centers and that there are resources available online that folks can be directed to for alternative ways to get tested. So thank you very much for all your work, Mr. Dudley.
Thank you.
Mayor Ross, did I see your hand?
I'll pass, Commissioner. Thank you.
Okay, all right. Commissioner Overman, you recognize.
And I'll make this quick. So we were able to actually test about 1,200 more than last week, which is, than scheduled last week. And in the report that we got from Dr. Holt, it looks like we had about 4,300 cases come back positive last week. The more positives we get, the more demand there'll be for testing because people will know more people. So I realize we're doing a great job, but having those resources on the county where they can get tested elsewhere, where we hit capacity real quick, is going to be really important. And I thank you for bringing that up. Having that alternative choice is going to matter as more and more people become infected or worried about being infected and want to make sure that they are not contagious. So thank you so much for your work. The numbers that we showed coming back positive last week are very close to the numbers that we tested with the county. So I'm getting nervous about having a capacity issue. So I appreciate your attention to this. I just wanted to say thank you again.
Okay. Mr. Dudley, thank you. And to be exact, Commissioner Overman, I've been keeping count since June 16th. We've had 6,362 positive cases. 6,362 in less than 2 weeks. Mr. Dudley, thank you very much.
Thank you, Mr. Chair.
Dr. Holt, you recognize.
Yes, sir. This is Dr. Holt, Florida Department of Health, Hillsborough County. I'll ask Kevin to go ahead and put up his presentation.
It's up, sir. All right, Dr. Holt.
Dr. Holt? I think we may have lost Dr. Holt. Mr. Watney, you want to go ahead and make the presentation? I think we lost Dr. Holt.
Yes, sir. I'll be happy to, Mr. Chairman. Can you see the presentation, sir?
Yes.
Yes. So I'll give the presentation as best I can. Obviously, I can't speak for Dr. Holt, just as a qualifier for the EPG members. I believe you received the presentation today as part of your packet. The first 3 slides are more of a general summary and a highlight for the EPG members and for the public. To date, as of June 27th, there was 9,918. When I looked at the data this morning, when it dropped, there was 10,300. So again, another increase of 400 from this weekend to Monday morning's report. But with that being said, over the last 7 days, there was an increase of 4,300 plus cases, or 77% increase from the last 7 days when we reported this on June 20th. The 0 to 34 age group is still the largest that we're seeing. They nearly had 60% of all the positive cases in the 7-day period. To date, the testing's been about 7.5% of the population when we look at total tests completed versus Hillsborough County's population. The rolling 14-day average is a 37% increase, nearly 449 on 14 days and 617 on a 7-day average. So we'll show that in the chart. Okay. The rolling 14-day average of tests, which we just had a conversation, has been increasing. So that's gone well. That's a 19% increase to nearly a 7-day rolling average of 3,100 compared to the 14-day, which was 2,600. So we'll show that in a chart. And the positivity rate, as we've all talked about, has gone up on the 14 and 7-day amounts as well. And we'll show that graphically.
Kevin?
Yes.
Kevin, this is Dr. Holt. I apologize. I guess I dropped. Are you still on our review slides?
I just finished the first slide. We can continue, sir, if you like.
Okay. Yes, if you don't mind.
And I apologize. I had a blue light, but I couldn't hear anything, or you couldn't hear me. As Kevin reported, we now have actually 10,323 cases as of this morning. That's a 400 increase. I would like to be hopeful that that trend would continue, but I would note that we only received half of the results we had the day before, so we're going to be watching this very closely. Our age hasn't changed really much. We're still seeing the 0 to 34. The 0 to 14 actually did see a large increase, but that's a small number, so the percentage was increased. And the long-term care patients represented, again, a very small number of these totals. We had 13 in the past 7 days. We are going to begin to look at, as we look at cases by age and race and other factors, we're going to use some rates per 100 or 1,000 or 1,000. This will reflect the overall risk that is occurring in those age groups, race, and others. We used our total number of cases to date. That's the cumulative risk, and we'll look at new cases over the 7 and 14 day, which is essentially more of an attack rate, what's happening real time. The new cases per day, I would like to mention in response to the caller, all of these test results are coming from a PCR-based test. These are the nasal swabs. As Dr. Lockwood and I have said, these are at risk for false negatives, not false positives. The reports, the labs that are not reported as cases are antibody tests. And those are the ones that have high positive, false positives, and that's why we don't report them. The daily positivity rate that we have seen increasing, again, can suggest we are seeing an increased amount of virus transmission, because ideally we'd like this well under 10%, if not towards 5%. With the expanded testing, as Mr. Dudley talked about, hopefully as these results come back the following week, we won't see this change immediately, but hopefully as we get more testing done, we will see this positivity rate begin to go down. The next slide, Kevin, is the hospital system.
Yes, go ahead.
The information that Kevin reported on the slide 625 has a hospital current census of 269. As of last night, that number is now 303. So that's a 13% increase from the 625, or 60% from 618, excuse me. The ICU census has increased, but not significantly. But we did see a decrease in the ICU availability, and that's mainly due to the non-COVID patients as hospitals have been reopening. More concerning that I added here was something we've seen, and that's the increased number of infected healthcare workers. Now, this is a number is a mixture of the hospital and long-term care facilities, but neither one can afford to lose any of their healthcare workers during this time, as staffing is always tight. So we're going to continue to watch this very carefully and speak with our hospitals to get real time. As you noted, the emergency room visits for symptomatic patients has increased notably, and again, the hospitals have shared this. I would then talk about the deaths. We now have 135 actually as of this morning. 88 or 2/3 of those are associated with long-term care facilities. looking at the last 14 days, we had 36 deaths, and the 14 days prior, we had 16. Again, I hope as we see more cases in the younger, this trend will reverse, because this is a lagging indicator. I did speak with Dr. Devers this morning, the medical examiner, and she did note that we have a number of cases reported to her since Friday, which we'll be reporting this week. Would mention that we looked into the recovered. The recovered information is based on the number that are still basically alive 30 days after the positive test. And if you look at this estimate, if we go back 30 days, then my rough estimate is well over 95% would have recovered. As Dr. Lockwood again noted, our death rate in this county is significantly lower than the state. I would sense of caution is that recovery does not mean people are well or back to normal. There's growing reports and evidence of delayed recoveries, people that have persistent symptoms, even cognitive loss of cognition, and recently a form of PTSD, mostly for the hospitalized patients. And I think Dr. Harmatz last week talked about that. The next slide, please.
Go ahead.
So my summary is our community-based transmission is continuing to be widespread with an increased amount of activity, the level of activity. Our testing, our demand had exceeded our available supply, but again, I expect that to change starting tomorrow. Our contact tracing is less effective, as I just described. Our patterns continue to be sort of the inner circle of families and friends associated with their leisure activities, entertainment, work. And again, disappointingly, we are seeing less cooperation from those that we reach out to. Asymptomatically, we continue to see about 11% was reported in the most recent 2-week period that were asymptomatic. The hospitals, I've actually been talking with them regularly this past week. They are concerned. They've shared their concerns with me. And we will continue to watch the numbers beyond just the availability of beds. They can expand the beds if they're able to have staff, but they're concerned that that may be a limiting factor. Based on the number of cases that we've had for the last 7 days, the hospitals and I both predict that those who were infected then, if they need hospitalization, will be getting to show up at the end of this week and into the next. And that's just the delay between when they were infected and when they become sick. My second observation is that as we have done some repeat testing in our long-term care, we're beginning to see that those that had a few positive cases in the last month, as we come back, we're starting to see some higher number of positives in those facilities. Again, this is a trend I do not hope will continue. We have a transition ALF to University Villages, and without that facility, the hospitals would have 60 to 70 more patients in their facilities. And then lastly, I mentioned deaths as a lagging indicator. So my final comments is we really need, if we don't begin to extinguish this outbreak sooner than later, even those parts of our community who have been less impacted will be. And we're seeing that statewide. Pasco has actually had the largest increase of cases in the past week. As I said, I underestimated COVID at the beginning between the asymptomatic spread and as one caller mentioned about the role of aerosolization. Both of these factors make this virus particularly difficult to stop. Governor DeSantis has been very clear about what needs to be done: social distancing and mask when you can't social distance. He's also taken action for those that he feels he did not take the necessary action, and he's paid consequences as noted. So we have July 4th ahead. We have the reopening of the schools and the university. I've been cautiously optimistic, but I'm going to be watching the numbers closely as we move ahead. I do remain hopeful, but we must accept that the vaccine is not around the corner, and our new habits need to become the new normal. Please, I'll stop there. And Kevin, if you would go through the details.
Yes, sir, I'll be happy to. Again, as indicated, the cases were 9,900. We've gone over 10,300 with today's report. Again, the male-female breakdown is still predominantly women in this county. 53% are tested positive, men 47%, and again, 7.5% tested, population tested as of yesterday. The rolling cases per day, the yellow is the last 14 days, and particularly the last 3 days from Friday, Saturday, and Sunday were quite high, as we see, with, I believe, Saturday exceeding over 1,000 cases positive results. The rolling 7-day average is, again, 617. The 14-day average is about 449. So again, the last 14 days have been quite high. The testing conversation, I will point to the last 4 bars. With regard to test results received, actually the last 5 bars have exceeded the 2250 estimate. Again, these are test results received from the FDOH, from the providers out in the community, again, as they get reported to the labs. So the biggest thing is the variability is ending, that we're getting a more consistent run of test results. And again, the last 5 days were quite high in the test results above our 2250 goal. With regard to positivity rates, again, the last 14 days, the last 3 in particular were 2 of them at 20%, and 1 of them was over 25%. The rolling 7-day average for positive results is nearly 20%. And the 7-day average the 14-day average is 17%. So regardless, the last 14 to 7 days, we've had nearly 20% of positive results based upon whichever metric. The hospital admissions, these are the daily admits as reported by the hospitals. You can see the trend starting around June 23rd, trending upward to 60 plus a day. Again, on June 27th, which is Saturday, only 56, but 56 is still high. We have the 7-day moving average, which is nearly 50 to 60 admits a day, and that's trending higher as well with the hospital admits for COVID. The ICU and non-ICU bed utilization, again, the last 5 days have been nearly 260 total individuals in the ICU and non-ICU. Again, 278 on June 27th, as reported by hospitals. A vast majority of those are in the non-ICU, 231, and the ICU has been stable around 47, but that is expected to change with increased hospitalization. The ED visits to the emergency department with the week start date of June 21st, as reported, was 798. That was nearly a 30% increase from the previous week of June 14th, which was 620, which was almost 100% increase from 6/7. So again, the ED visits are occurring at the hospitals as well. With regard to the deaths as discussed, we've outlined just the indicated deaths per day. Again, there's float based upon when the death occurred to when it gets reported, but you can see the trend of the deaths reported per day with the 7-day rolling average that is slightly upward from where it was at the beginning of June to now to nearly 2.5 per day on a 7-day rolling average of deaths. And as Dr. Holt indicated, more deaths have been indicated by Dr. Devers as well. And that's all. I'll stop there.
Thank you, Dr. Holt. Thank you, Mr. Wagner. We have some hands up. Mayor Castor, you recognize?
Thank you, Chair. I just want to ask Dr. Holt to say one more time, what is the simplest and most effective step that we can take as a community to stop the transmission of this virus?
Yes, ma'am. I will again repeat what Governor DeSantis has said pretty much most of the weekend. He needs people to follow the rules, social distance, and wear the mask when they're unable to do so.
Okay. Commissioner Overman, you recognize?
Thank you. Thank you very much. And thanks for the question, Mayor Castor. Dr. Holt, you've indicated on slide 2 that testing, contact tracing effectiveness is negatively impacted by dramatic surge or decrease of cooperation. But based on our numbers, and we're seeing a 20% exposure of those, increase in numbers, is it safe to say that, if you bump into 5 persons a day, there's one of those persons that's positive at this point? Because we're having difficulty discerning asymptomatic infected individuals and, a limit on testing and now an increase on emergency room visits. People are realizing they've been infected and are going to the hospital or are trying to get a test when it's delayed. We're going to be overrun pretty quickly if we continue this trend. And I hear that, but to Mayor Castor's question, the best way we can actually fight this is or fight the trend that we're on, and we can't really get off of it at this point, is to assume each of us have it and wear a mask and protect everybody else. Is that safe? And if you have not been contacted, but you know people that have tested positive, is it critical that they go get tested?
Yes, ma'am. Thank you for that question. Yes. In fact, I think throughout the state, we are not the only county experiencing the surge, and it's that no matter how fast you get people in, it takes time to get them ready to be activated, if you will. So while we've had a huge or a significant increase in staff over the last 7 days, many of them are just coming fully online this week. So we have been messaging, and the state is messaging out that if you know of someone or you believe you've been around someone, we strongly recommend you go ahead and get tested. That's the best way to know. Even if your test is negative, does not mean that you haven't been exposed or you might be infectious over the next week, but it is an important starting point. So a negative test for someone who's known to be exposed, unless it was probably 10 to 14 days ago, you should still continue to do what we've asked: social distance, wearing the mask when out, and actually limit the times you are out of your residence. So, and that's the biggest difference between, I said last week, I think, between an exposed person and the general public. And that is only to stay closer to home if you have a known exposure. I'll stop there.
Commissioner Merman, you recognize. Commissioner Merman?
Okay, thank you, Doug, for your report. Appreciate the information. I have a couple of questions. I think almost all the hospitals have COVID units within their like ERs when patients, are they included in the admissions or the ones that are actually in the units, and when would they be included in the admissions?
I mean, I'll speak as what I am aware of. Most of the ERs have what they call an alternate assessment. They call it an alternate care. And that's for anyone who screens positive with questionnaire or fevers. They go there to get further evaluation. And most of them, if not all of them, get tested. And based on their clinical condition, they are then assessed whether they require admission. If they're admitted, then they go to a COVID unit. This can be located in a non-acute setting or non-ICU, and each of them really have dedicated floors, if you will, or portion of floors that they would house those that are known to be positive and don't need ICU care. For those that need ICU care, again, most of the hospitals have dedicated an ICU or more, depending on their volume, to care for those patients in a dedicated area. Hope that answered your question. I'll stop there.
It did. And I guess what I'm trying to do is come up with a more accurate picture of patients in our hospitals, because like I think that when you brought up about the University Village, and if we didn't take patients there, we would actually have our hospitalizations would actually be 60 more people, not where it is now. Is that correct?
Yes, ma'am. These patients only get admitted to University Village directly from the hospital, or if they would have normally gone from a long-term care to a hospital, we can divert them. So every one of these were either headed towards or came from a hospital.
Okay. I think it's just for the listening public more than anything, because they look at every word we say here at this EPG meeting. They look at every number we put down on paper, and they kind of come to their conclusions. I think this week, though, it is different. Our death rates is rising, hospitalizations are increasing, but if the bed capacity has not changed, why would that be if all these other numbers are going up?
Well, that's a little harder for me to answer. My sense is that they are doing their elective procedures, admitting patients. They've always focused on short length of stay, and the total number of COVID patients, while they really aren't very big compared to the totality of the number of beds in the hospital. And so they're able basically to manage the other patients in a way to keep their occupancy or their availability relatively stable. But I think recently, and they have seen and watched very closely the situation that's going on in Houston. Houston is a medical mecca. It has a tremendous amount of hospital resources, and they have reached the point where they have canceled elective surgeries or procedures, and I know the hospitals are doing their best to avoid that happening here. So I'll stop here.
Okay, thank you. I really appreciate the information. I'm trying to, I just want the most accurate picture to be out there for the public, because I think people feel like, well, yeah, our cases are increasing, but nothing else is. And that really is not the case. We do have 60 more people at University Village. We do have, which is saving us on hospitalizations and bed capacity. So I guess, I think that's the point I was trying to get to, was just, if there's other numbers that out there that should be included in these numbers, then we need to make sure we're accounting for them so that the most accurate picture goes out to the community. So I appreciate all your information, as always. Thank you very much.
Ms. Snively, you recognize.
Thank you, Mr. Chair. I just had a follow-up question from some information that I think Commissioner Merman and I both offered last week. It was a snapshot of information from Sarasota County, and I have received multiple positive feedback on that dashboard or that snapshot, and was wondering if we as a county are able to create something similar to that to, continuously put out to the public, whether on the Hillsborough County page or to the news media or wherever. But it's a pretty, comprehensive snapshot. And I was just wondering if we were any closer to offering something like that up to the public. Thank you.
Chairman Miller, this is
Ms.
Bonnie.
Wise, you recognize. Yes, you recognize.
We appreciate the EPG members providing us with various samples of other snapshots that they have found helpful. We actually have a meeting about that tomorrow morning to see if we can consolidate some of this information into a more quick view type of format for you, and then provide this additional information just as backup for you as well.
Thank you. I wasn't sure if that was a question for Dr. Holt or you, Ms. Wise, but thank you both, because I know you'll have to work in conjunction with each other to get that accomplished. So thank you for doing that. I think it'll be very helpful for the public.
Yes, ma'am. This is Dr. Holt. We are working, I know, with, and we've talked about that, so that the DOH Act, the information available to DOH from DOH can be loaded in and directly put onto a dashboard. So, we are opening up our data and making it fully available so that we can achieve that goal.
Thank you. Thank you both very much. That's all.
Mayor Lott, you recognize.
Thank you, Mr. Chairman. We're obviously Freedom Village was a very wise decision by the county, and I'm very glad that that was a decision that was made, because when that decision was made, the numbers were nowhere near where they are today. And so if there was a crystal ball looking forward, whoever had that crystal ball, congratulations to them. You knew exactly what you're doing with that decision. But a question I have is, knowing what we have today, where are we with opening up a second Freedom Village? Is that something is that a final decision yet? Is that something we're discussing? Can you give me a little bit of an update on that?
Who would like to answer the question? Okay. Go ahead, Dr. Holt.
Yes, I'll start. We continue to be on the lookout for, there's two ways to accomplish this. You find a facility, and the ideal one now, and speaking with the hospitals, is one that would allow a higher level of care, essentially a skilled nursing facility rather than an ALF. So we have approached facilities that have lower census, those that have previously had some positive cases and have established isolation units, but to yet we've not been able to find the willing partner to do that. So we have two ways to do it. We get somebody who's willing to take the patients. They can still then use their staff and their payment methodology. Many of these patients are insured, or we could help them for those that aren't. Or we try to do what's very difficult, and we were very fortunate with the University Village. We find a facility that was essentially empty, ready to start up, had all the equipment, and were able to do the staffing. So Secretary Mayhew participates in our weekly calls, and she shares this goal. And actually, we're working on both sides of the bay to achieve just what you're correctly identifying is a critical asset for what's ahead. I'll stop there.
Okay. Commissioner Merman, Commissioner Merman, you recognize.
Thank you, Mr. Chair. Thank you, Mayor Law, for bringing up about University Village. There are some concerns from residents that are actually have been there. These are elderly people who have a lot of fear about this disease. I think it will impact them. Though I think it's great, I agree. I think it's the best thing. But the reassurance that we have to provide to those residents needs to be above and beyond everything that we can do, because there are concerns. I have answered several one-on-one. Jean Early has helped me quite a bit. But I think that, yes, it's good to put them there, but there is kind of a cost. A lot of people there are very fearful that even though you have separate air conditionings and separate wards and everything, they still don't like COVID patients being on the same premises. So I just wanted to let everybody know that this is a really good move we made, but we still need to go above and beyond to make sure the current residents' questions and concerns are being answered. Thank you.
Commissioner Overman, you recognize.
Thank you very much. And I think it's what's important to make sure the public understands is if this is correct, and I want to make sure I'm not incorrect here. Kevin Wagner had suggested to us that the 7-day average, daily average, is now 617. And based on this part of the report, where we talk about those that are in COVID, non-ICU, and ICU, is around 231. So and that's just for the date of June 27th. That means there's like 400 people that are in the community that are at home and not in hospitals that are fighting COVID, but staying isolated, we hope, not getting public, we hope. But we're not symptomatic enough to actually require hospitalization. Is that a correct assumption? Am I reading these numbers correctly? Is that accurate? Dr. Holt?
Is there one particular slide, if I could bring my attention to? I apologize.
Well, I was looking at slide number 6 that shows the cases per day, the rolling average of cases per day, which has gone from, on slide number 6, it's where it lists average case per day went from 449 on an average 7 days, 617. But then when we look at slide 10, it shows us that 47 are COVID in ICU, but our hospitalization rates are going up, where there's another 231, or included in that number is 231 that are non-ICU COVID patients, including the COVID patients. So if we've got 231 in the hospital right now, and our daily average is 600 and change, that should mean that 400 people were able to go home, or they're in our isolation centers, or they're in the community. They weren't hospitalized. They weren't so ill they had to stay in the hospital. I mean, if that's 617, all had to be in the hospital, we would clearly be in trouble. Is that accurate?
It is, in the sense that the hospitals have indicated that they are able, and I think they presented it, to keep many of their admissions in a relatively low length of stay, and some percentage of them accumulate over time, which is why the census drive is going up, is that they're not able to discharge daily as many as they admit. And again, this is a raw estimate. If you look at an estimate that they're admitting on average, let's say 70 a day, and you compare it to the average number per day of positives, we actually have about a 10 or so % of the cases actually require admission, which is below the historical 20%. And I think that goes to what the governor and all people are saying, is that what we see is a much higher number of our cases are in that below 34, and their admission rate is going to be in the 5 or less %, whereas those who are infected that are 55, 60 plus are going to have a higher, but they make up fewer cases. So it's a very dynamic situation, and that's why they come up with the modeling programs that I know did not, weren't accurate, if you will, did not accurately reflect what we predicted in the past. But again, a lot of that was because of intervention. So they are trying to use that modeling, but it's hard to do that when things are changing so fast. I hope that answers your question.
Thank you, sir. I appreciate you attempting to help make that point. But what it's clear is we've got a lot of folks in the community that are fighting COVID at home. And the good news is they don't have to be hospitalized. They can actually recover as well as they can. But I appreciate you interpreting that. Thank you.
Yeah, no, I totally agree with that. Like I said, 90% of our cases are at home, and most of them will recover. Absolutely.
Commissioner Merman, you recognize.
Oh, forgot to take my hand down. Sorry.
Okay. All right. Dr. Holt, Mr. Wagner, thank you very much. Appreciate your presentation and answering the questions. County Attorney update, Ms. Beck.
Yes, good afternoon, EPG board members and Chair Miller. Christine Beck, County Attorney. In your backup materials, we provided a copy of the Department of Business and Professional Regulations Order 2009. This order took effect on June 26th, and it does two things. The order prohibits the consumption of alcohol on the premises of any business that derives more than 50% of its gross revenues from the sale of alcohol. And restaurants under Chapter 509 of Florida statutes are allowed to continue to operate if they derive 50% or less of their gross revenues from alcohol and they serve food and beverages at tables. So that order has now been in effect since June 26th. The second item on the agenda is the face covering order, which was passed on June 22nd. And this order was directed to be reviewed every 7 days in conjunction with the order extending the local state of emergency. And at your June 25th EPG meeting, 4 issues were raised by board members for discussion today. And of course, there could be others, but I'll just briefly go over those 4 issues to remind everybody of those points. The first one was that Vice Mayor Ross suggested raising the age and the exception set out in 9A from 2 to 8. The second was raised by Commissioner Merman, and it was a suggestion to add an exception that would accept children under the age of 18 from participating in youth activities, including youth sports teams and leagues, youth clubs and programs, childcare, summer camps, and youth recreation camps. And if this board agrees after discussion, those are both matters that could be amended. And the third item was raised by Ms. Snively, and she wanted to discuss paragraph 7 of the order. And I will let her address her issues, and we will be able to respond to questions and offer any alternative language if needed. And lastly, Commissioner Overman wanted to discuss not-for-profit entities that have enterprise services like a business. And again, I will let Commissioner Overman address her issue, and we will be prepared to respond to any questions and offer alternative language if necessary. So with that, Mr. Chair, I'll turn it back to you and be available as needed.
Thank you, Ms. Beck. Commissioner Merman, you recognize.
Thank you, Mr. Chair. I would like to make a motion to add an exception to the policy for children under the age of 18 that participate in organized youth activities, including youth sports teams and leagues, youth clubs and programs, childcare, summer camps, youth recreation camps, and private, public, or nonprofit activities. And that's my motion. And this would be, this is sort of identical to what they have in Pinellas, age 18.
Is there a second? Is there a second?
I'll second that, Commissioner Miller. This is Melissa Snively.
Okay. Is there any discussion on the motion? Any discussion on the motion? Any discussion on the motion? Seeing none, please call the roll.
Miller,
Yes.
Overman, Overman,
Yes.
Merman,
Yes.
Lott,
Yes.
Caster, Mayor Caster,
Yes.
Roth,
Yes.
Cronister,
Yes.
Snively.
Yes.
Motion carries 8-0.
Okay, thank you.
Thank you.
Mayor Castro, you recognize.
I'm sorry, I put that up a little too late. I was just going to ask you to repeat the motion.
Oh, I'm sorry.
It's okay.
It passed, but can you repeat what it says, Commissioner Merman?
Absolutely. It said it would exempt all children under the age of 18 participating in organized youth activities, including youth sports teams and leagues, youth clubs and programs, childcare, summer camps, and youth recreation programs, and private, public, or nonprofit activities.
Okay, thank you. Ms. Snively, you recognize.
Thank you, Chair. If it's appropriate to go ahead and talk about paragraph 7, I'd like to do that at this juncture. Thank you,
Yes.
Mr. Chair.
You recognize.
Thank you, sir. I just wanted to kind of revisit this with the group based on some of the feedback that I've received from several small businesses in our community. I mean, this impacts thousands of small businesses in the community. And I think that the challenge that I'm hearing that most businesses have, and I'll speak also as a small business owner, is the portion of this particular order that penalizes or criminalizes this mandate for the business owner or operator. And so basically, if a business operator doesn't enforce the order, just as a reminder, the operator could be prosecuted with a second-degree misdemeanor, up to 60 days in jail, or 6 months probation and a $500 fine. And so some of the business owners that have reached out to me are concerned about being criminally liable for someone without a mask who walks into their establishment, and that they feel that as business owners and operators and employees that they should not be the ones convicted of crimes that they haven't committed, or be de facto police in a sense, because now we're enforcers of the law also. Now, I'm not saying, unfortunately, I don't have the solution to this necessary, but I know that it's wrong to criminalize business owners and operators and put some undue strain on them when businesses are trying to recover and reestablish their businesses. So this is just one more responsibility that they're having to contend with. And I've heard various stories, as you may have also, between public comment and email and phone calls and messages of examples of, customers who come into the establishment and either refuse to wear a mask or are uncooperative. Maybe they have a medical condition and the business owners are, responsible for policing them, basically. So I just wanted to ask, and maybe we can ask Ms. Beck, what is an alternative to criminalizing this and penalizing business owners by fining them or putting them in jail for this responsibility? Is there some alternate solution if we could take this particular paragraph out of the order? What would be a suggestion? Thank you.
Yes, Mr. Chair, may I respond?
Yes, ma'am.
Yes, Ms. Snively, the Florida statutes clearly provide for the penalty that's in the order as written. However, we've looked at the statutory language and our ordinance, and we do believe that there could be an avenue for the utilization of code enforcement potentially for perhaps helping with the enforcement. And then the only other comments I'll make, just so that you have a full kind of range of options. In Monroe County, for example, they put in their order a statement that it would be a defense for an operator of a business to if they asked a patron who refused to wear a face covering to vacate the premises or face a trespass, that provides a defense to them. So that's something that you may find helpful. And of course, businesses can always refuse service to the patron too. But those are perhaps some ideas that might provide more for discussion.
Well, and with your permission, Chair, I just wanted to see if there were any other members of the EPG willing to have a conversation or discussion about alternatives, or if really just taking the temperature of this group to see, what the interest was in protecting small businesses at this juncture. So, is there anyone
there's some hands up right now? So
okay.
Just hold on.
Thank you.
Mayor Ross, you recognize.
Thank you, Commissioner. I too think that perhaps paragraph 7 could use a little work. I'm not shocked at that. I mean, we came up with this thing pretty quickly, and as anything that happens that quick, you realize things that weren't intended. But I do think that paragraph 7 could use some work, and some of my suggestions might include to change the language that says it requires and compels the business owner to remove the person. That could be softened a bit. I could see paragraph 7 reading more along the lines of it requires the business, unless it's an exempted type of business, to require employees to wear face masks, it requires them to put placards and signs at the entrance to their business. It requires them to make routine announcements if their business is so equipped, like a Home Depot or grocery store or something like that, if they have that equipment. And it would require them to make reasonable efforts at compliance. And then if Christine, if you wanted to go beyond that and talk about what that would be, not that many people doing that as opposed to this. So I get that. But I would say that if we could do those 4 things, the employees have to have signs, they have to make announcements if they have the equipment to do so, and they have to make reasonable efforts. I could live with all of that, and that might soften some of the concerns that I've been hearing as well. What I wouldn't want to do is to take that completely out and put the onus on the police. And first stab at this might not have been perfect, but I don't think the solution to that is to go right back to putting it on the police. I can't support that. I just can't do that to our officers at this time. They're just getting we don't need to promote more conflicts with the public with everything that's going on.
Mayor Ross, let me ask you a question. Of the four things you just said, you're not going to put a requirement on those people that come into the business to put on a mask? I don't think I heard that. Mayor Ross?
No, you didn't hear that. That's right.
Okay. Mayor Lott, you recognize.
Okay. I have a question for Ms. Beck. I see the desire of School Board Chairwoman Snively and Mayor Ross, and I think, you know, the whole group's trying to figure out what is enough to put some teeth in it to where people have the desire to, want to comply, and then, but not so much where we criminalize someone. I think that's the, that's the quandary we're sitting in here right now. But so if we changed it from a misdemeanor and took it to some type of a civil situation, okay, and Ms. Beck, if we required the businesses to have a signage on the front door that stated what the policy is, okay, would that cover the business owner where he's not or she's not complying with the order?
Mayor Lott, I understand what you're saying with regard to the required signage, and I think the way the order is currently drafted, it's strongly encouraged in paragraph 8, and perhaps that's another change that could be made to require the posting of signage. I guess it's really up to this board whether you consider it to be sufficient that if they post that signage that they're in full compliance, even if somebody doesn't comply. Because right now, the way the order is drafted, the individuals are not subject to enforcement. It's just the business operators, and so that's certainly an option. But I think it would probably need to be discussed by the board.
So to expand on that a little bit. So if I owned a business, and when you came in my front door, if it showed that it had the language that maybe you could spell out for our business community, okay, that they could put on some type of signage, whether they type it up or however they place it on the front door where it's definitely legible, okay, would that cover them so that if someone did come into the shop, they didn't have a mask on, someone did call, whatever authority that, our city, Temple Terrace, Tampa, or the county's going to use to enforce this, okay? And if they show that, hey, we are compliant, we have our signage up, it says what our rules are, and but I'm not going to kick this person out because of they meet those requirements. Aren't we saying then that they are covered and they would not be charged with anything? I guess that's what I'm trying to get to. They covered it. They are complying with the signage and the rules are clearly stating it. This is how we're abiding. This business is abiding by Article number 7 in the order. That's what I'm asking.
Yes, and Mayor, we could certainly draft that notice. We could provide that and make it part of the order, and we could make it such that the business operator is required to post it. But then it's I think a policy decision whether you would deem that sufficient at that point to say that they're fully in compliance, which is certainly an option. But if a patron maybe just doesn't wear the mask and doesn't have an exception, and in essence is violating the order, that would be something that would not be addressed, and maybe those are so few and far between that that's acceptable. But it would require us to tweak the language in the order to clarify that. And it involve both paragraph 7 and paragraph 8 to achieve that.
Okay, so that's where I'm leading to. So at least it's clear to the owner of the business, the operator of the business, and to the patrons that are coming to the business. Okay, it's crystal clear. It's on the front door. Okay, and I don't believe you ever get to 100% participation in any order, any rule that we ever have, but we're trying to get the most participation as possible. But at least that point in time, it shows the person that would be enforcing it, because everyone has the ability to refuse service to someone, just like what Mayor Ross said. If they were inside smoking in a restaurant that doesn't allow it, they could ask them to leave, or it's their choice to not to ask them to leave, and they have the consequences of that. But my point is that I believe that we could simply put proper signage in place if it's written out by you, okay, or one of your staff members, so that there's a consistency across the county, that, you know, this business is abiding by the order, and here's the notice on the front door and the front windows and so forth, wherever they want to place it at, okay, but it definitely would have to be in the entrance of the facility. And if they're doing so, and as long as they're not just using that as a, you know, a get out of jail card, okay, then obviously no one's going to be going in from one of our cities or the county and trying to and enforce something because there's one or two people in that facility that aren't abiding by the order. And I guess that's my what I'm hoping you're telling me, that if we did that, that would be a very simple way to make everyone or make more people happy about paragraph number 7.
Yes, it's definitely something we could draft, and it would certainly relieve some of the perceived burden from the business operators. And if we're directed to do that, we could do that.
Commissioner Merman, you recognized.
Thank you, Mr. Chair. Okay, we have a public health emergency, number one, and we need to educate the public about how serious it is. There is so much confusion among businesses, especially our small businesses. There's 80% of our businesses in Hillsborough County are small businesses. We need to keep them open. We need to keep them functioning, producing jobs and consistency. Mayor Lott, you hit the nail on the head. What I am concerned about is that people walking into businesses that have health conditions and the employees are saying, I don't care, and they're still refusing admittance. That just is not right. And so if we are doing anything to paragraph 8 or paragraph 7, I think we've got to include the health conditions have to be paramount. And somebody should not have to prove that they have a health condition. That's one employee asked somebody, well, show me some medicine or show me your doctor's order. I mean, to go to a business and try and help our economy here in Hillsborough County, I mean, honestly, I think we need to do a better job of educating everybody. And if we're going to do signage or whatever we have, please, let's stress that somebody has a health condition, asthma, like right now, allergy season is here. We've got this dust cloud. A lot of people have breathing issues, and we cannot ignore that. And we have to make sure that we have proper protections for them and for our, and I want to protect our businesses. Gosh, these guys, they're having a tough time. Thank heavens they're open. Now some are having to close again because of the governor's order. But let's do what we can to make it as clear as possible, and that the enforcement is not that, I don't want to take all of it out, but that it's softened to civil citations like in St. Pete, or it's softened, and let's just take away the misdemeanor. I think it's too harsh. I brought the amendment up at the last meeting when we did the policy, and it failed. So let's just go back to the drawing board on these two sections and make sure that we're doing everything we can to protect our citizens and our businesses. Thank you.
Commissioner Overman, you recognize.
Thank you. And I do think it's important to have this conversation. we've all been getting a lot of emails, and those of us that pay attention to social media in the middle of the night and read through the stuff that's posted. What I have seen is, while I have heard our business owners, they are concerned about their responsibility and how to respond and keeping their employees safe when a customer refuses to accept that they need to wear a mask when they enter their business. And that is a concern. But what we have seen over the last week is a significant increase inside businesses of people wearing face covering and masks. So it is working, because not only are the businesses being diligent about helping people recognize they need to wear them, but citizens have heard they need to wear them. And so I think that information is very important. While our order doesn't hold citizens accountable and to wear a mask in a business, it does hold the business owner accountable. And that makes it an uneven fight on this, which is unfortunate. But that's the approach we've taken. To support the businesses is important, to give them guidance on what signs they need, what they need to do when they have a customer that refuses to comply. But when we look at the police reports that we've been looking at, on average, on the business, there's only been literally 3 calls a day. Whereas we've seen, 2 or 3 times that of citizens calling in to indicate that they're in a business that someone's not wearing a mask. So it still needs to hold the businesses accountable, and signage will help. But I would hate to do anything that would actually erode the great response we've seen by businesses helping people understand the importance of wearing face coverings inside, and a messaging to the citizens that, there's no penalty to business owners now, so, I'll just go in wherever, without wearing a mask. I don't want to send that message. I think it would be harmful to where we are with our numbers where they are. So I think it's going to be very careful if we change this, rather than hold the penalties in place and give the business owners protocol on how to protect themselves legally when they're trying. And I think that's where our best solution may be. Posting signs is a good way to do it. Calling in to the sheriff's office and say, hi, I'm having difficulty with a client or a customer. I don't really want to trespass them, but I could use your help. And that might document that they are doing everything that they can. So, in the ordinance that we're looking at the county level, it is graduated. But from what I understand from Ms. Beck, that's not really an option. It's an all or none. And if we're able to do a graduated step and still keep the penalties somewhere in place in the event that we have a business owner that just doesn't want to believe that this is important, then that's where those penalties should lie. But for those that are really trying, we need to give them the tools. So I don't know what that solution is, but what I don't think is reasonable is to take away any of the penalties that would erode the progress that was made in the last week. And I'll stop there.
Mayor Ross, you recognize.
Thank you, Commissioner. Well, Mayor Lott, what you said is exactly what I'm proposing. That was my idea. If the business is a qualifying business, they have to require their employees to wear it. They would have to put signage at all their public entrances. They would have to make periodic announcements if their business is so equipped, and they would have to make reasonable efforts to ensure compliance with the mandatory masks. If they did those things, then what you said is exactly what I'm proposing. They would be covered. There would be no violation. And that's exactly what I'm proposing. If that's acceptable to Ms. Snively, I'll get to a motion about that. The other thing is, I don't care if it's a second-degree misdemeanor or a civil infraction, but my understanding is that all of our orders are governed as our second-degree misdemeanors by state statute. I didn't think we had the ability to make them civil citations. If we do, it can be a civil citation, it's fine with me, but I didn't know we even had that ability. And that's it. And then Commissioner Overman, your statements are exactly right. We're seeing only a few calls about business owners not complying with the ordinance. but we're having 3 or 4, well, you said 2 or 3 times the same number of calls about people in the stores. Well, currently the police don't have to respond to that. And that's exactly what I'm trying to maintain, is that they don't. Because if they have to respond to, I don't know how many there would be. It may not be as bad as I'm making it out to be, but if they had to respond to 10 calls a day about a lady shopping in aisle 4, we can't have the police being burdened with that. They're already getting calls about people gathering. They're getting calls about bars serving when they're not supposed to be. They're already getting a lot of COVID-related calls. We don't need to pile on top of that. And my intent here is to thread a way to achieve compliance, which I think we largely have. I think you're right. Over the past few days since last week, we've seen a lot more people wearing masks than we did before. So I think, voluntary compliance. Unfortunately, all of our orders have an enforcement component. That's the way the law is written. But I don't think anybody's getting dragged to jail for not wearing a mask. I just don't think that's happening.
Mayor Lott, you recognize. Mayor Lott, you recognize.
Mayor Ross stole my words there. Still, he said what I was about to say. So thank you.
Mr. Nibely, you recognize.
Thank you, Chair. I do appreciate the conversation and the willingness to, if you will, soften paragraph 7. I'm still challenged because I feel like it's an individual responsibility to wear the mask and not necessarily a responsibility of businesses, and that responsibility should not interfere with a business or create a criminal penalty to the business. You did have a good question, Mayor Ross, about a civil penalty as opposed to a criminal penalty, and I wanted to see if Ms. Beck could answer that question, if she has the ability to answer that, please.
Yes, I was trying to do that in the introduction, and what I was trying to say is that all of the orders historically for the EPG have been enforced the enforcement language has included the language out of Florida statutes, which provides for the second-degree misdemeanor very clearly. But in hearing the concerns of this board and in reviewing what has gone on around the state where other counties have looked at the challenging issues regarding face coverings, we really looked to see if we couldn't find a way by interpreting both the state law as well as our county ordinance creating the EPG to find a path that would allow for a civil citation enforced through code enforcement. And after having, done a very deep dive on that, we do believe that would be a defensible option for this board to consider. And I've got Rob Brazel on the line as well. If you want to do a deeper, have additional questions or want more details on that. But we do think that it is something that could be utilized if that helps with the issues concerning law enforcement. So yes, I hope I answered your question.
May I ask a question? And somebody please answer this for me. I heard what Mayor Ross was saying concerning the signage and concerning the mere fact is that the business will have their employees wearing masks, the signage of social distancing and things on those lines, and taking the misdemeanor aspect out of it. But I don't understand why you're now saying if we do all that and customers come inside the business and don't put a mask on, what's the deal? I mean, it appears to me that you're taking the onus off of the people to wear masks. You're just saying, okay, employees, you wear a mask. We have signage up that we want you to wear a mask. But somebody comes in and 10 people come and say they don't have a mask, so they're in the business anyway, and there's no repercussions or onus on anybody concerning the customer wearing a mask. I don't understand that. Where do we put the responsibility on people to wear a mask. I heard Ms. Snively say it's an individual's right. Everybody we've heard from, experts say mask cuts down on the spread of this disease. Even the Vice President of the United States went against his boss yesterday at a church and said, please wear mask. I'm just trying to figure out where's the onus on the people that tell them to wear a mask if we're going to do what we're talking about doing now. Somebody please answer that question for me. Okay.
Commissioner?
Yes, sir.
I don't know if I'll answer it to your satisfaction, but I'll chime in. And I don't know how the sheriff feels about this, and if I were him, I wouldn't appreciate it if I threw him on the spot here about the enforcement of this, but I do know how my police chief feels and some of the others in the area. And if we're you really think that we're going to have a widespread disregard of this, where people walk up to a business and they see a sign and it says you must wear a mask, and they're going to say, no way, I'm not doing that. And they're going to go into if it's a friendly business and the manager might be saying, hey, we'd really like you to wear a mask and we'll give you one if you don't have one. And the person's going to say, heck no, I'm not wearing a mask. So the manager backs off. Is that going to happen? Yeah, it's probably happening now, and it's going to continue to happen. Is it going to happen widespread? I just don't think so. On the other hand, I do think if we put it on the individual, which I'm not trying to be argumentative. I get it. That's clean. It's clean and it's simple. We could have a one-page order then. It's very clean. However, then we're going to have all of our law enforcement going every time somebody's in the store, some other customer is going to say, oh, there's a guy on aisle 8 and he's not wearing a mask, and I want the police to respond and make him get out of the store or give him a citation for wearing a mask. Well, I don't know how the sheriff feels about that, and he can answer if he wants. I'm not going to put him on the spot. But I know how our police chief feels about that, and we just don't need to get dragged into that. So I don't know if that's a good answer, but it's an answer.
Well, I appreciate you trying to answer the question, and to a certain extent, I don't agree with it. But the fact of the matter is, I just don't understand when in 13 days, we've had 6,362 positive cases. And here we go now, basically talking about making this a glorified recommendation. That's what we're talking about, a glorified recommendation by putting signs up. And I'm not talking about the police right now. I mean, I'm talking about putting signs up saying wear a mask in here. And we all of us know that there are going to be people that's going to say, I don't wear a mask. You just heard Ms. Snively say it's a person's right to decide if they don't want to wear a mask or wear a mask. And they're going to walk into a business and the sign's big as day, it can be bigger than any of us. And the person walks in there and says, heck with it, I'm not going to wear a mask. You get 1 or 2 or 3 in there, and it's going to happen. Let's just face the fact, Mayor Ross, it's going to happen. And we're talking about 6,362 cases positive within the last 13 days. My question again is, somebody has to put the onus on people to wear a mask, or is there something that's got to be brought against them? I don't seem to understand for the life of me what's the negativity about people wearing masks, and we're talking about saving lives. I know I'm going to get some emails again. Just as long as you don't mess with my family, send the emails. But I just cannot seem to understand why, and I just had to put that out there. I'm done. Ms. Snively, you recognize.
Oh, thank you, Mr. Chair. And I appreciate your comments. And, this was a healthy discussion, and I'm not sure if, we're going to vote on changing anything today. I can count. I'm not a math major, but I can do the math. But I do understand the frustration. And in my personal opinion, I am not anti-mask. I am anti-mandate. And so either way, I can't support philosophically the mandate, but I do support people wearing the masks by choice and to help stop the spread of the virus. But either way, I think it's difficult to choose who to put the onus on. If I had to decide, I would not put it on the business owners. I would put it on the individuals. I think you're going to get 911 calls no matter what. But just like a seatbelt law, if my 19-year-old takes my truck that's in my name and goes out and gets a seatbelt violation, he gets the violation, not me. I might own the truck, and I might, he might even live in my household, but he's the one who gets the violation because he's the one who's not wearing the seatbelt. Okay, I don't get the violation just because I own the truck. So that's my point is, either way, I'm probably not going to be happy with however the mandate shakes out, because I don't think it's fair that we have to do it anyway. But I would prefer the onus to be on the individual versus criminally penalizing small businesses for it. So that's I'll leave it there, and we can, I guess, decide whether there's going to be a motion today or next time we talk about this. Thank you.
Ms. Snively, for once, I agree with part of what you said. Remember that. Get that down today, okay?
Okay, we'll take a note of that. Thank you, Chair Miller.
Commissioner Altman, you recognize.
Thank you. And I think we're actually trying to get to the same place, but I think part of the point that our business owners are saying is, I'm trying, but I have people who come into my business that aren't, and they're not held to the same standard. Is there any way within this scenario, when a business owner, instead of calling, 911 to trespass someone, if they're calling to indicate that they have a customer that is not complying with their their face covering, that the individual that is not complying could also be charged with the same charge? As I said earlier, it's not fair when we have an uneven playing field in this equation. And while I don't think we could mandate those same charges for everybody everywhere, obviously, but because we've identified, indoor spaces as being the risk factor, Christine Beck, is it possible to include a provision that if the business owner, in attempt to, if we put all the signs and all the other steps that Mayor Ross mentioned in there, that proves that the business owner is doing everything they can do, that if the business owner calls, that the customer that has become a problem could face the consequences only in the event that they violated that rule?
Commissioner Overman, as you know, the original draft did include individuals, and then we took it out. And the way I'm understanding your question is if there may be some perhaps middle ground, and what I would see as possible middle ground would be to have it so that an individual could be subject to enforcement only if after being requested by the business operator, they were unable to identify an exception that would apply. We'd have to work on that language, but there may be a way to make it so it's just not, maybe it makes it a little bit harder to enforce against the individual. It would be almost like if there was just outright non-compliance and not even articulating why the order doesn't apply to them. That's just an idea off the top of the cuff. I don't know if that's what you were possibly considering, but we could certainly work on that more if you were interested in us doing that.
Well, I'm interested to see what other folks think of that concept, but I do like the steps. I like the outline of things that business owners can show that they are doing everything possible to be in compliance. But at the end of the day, if someone's got a health emergency a health crisis or a health challenge that keeps them from wearing a face covering, they are probably at risk of serious risk of COVID exposure. That's a real problem. So that's a problem that does need to be addressed. So those individuals that are refusing to wear a mask in a business that's trying to comply are very possibly fraudulently pushing the rules and putting a business owner at risk, and that business owner's employees and customers. So I'd just like to hear what other people think, if that maybe would be a good compromise, if we take the steps for signage to help a business show that they're doing everything they can, and then level the playing field when they have a customer that refuses to comply with the rules in order to reduce the risk to the business owner. And I'll stop there.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. I think that's where all of us have been headed, is that the responsibility be on the individuals. If a person walks in, does not wear a mask, then we're going to penalize the business owner. I mean, the person of their free will walked into the business. I mean, he doesn't know who's going to come in and buy his stuff or do business with them. So I just think that, and actually, representatives from Tallahassee from the National Federation of Independent Businesses called me and spoke to me about that and said that it's just blatantly unfair to penalize the businesses, especially small ones, when it's really the individual that needs to be told, comply with the order. And I think that's where we're at. If it wasn't a public health emergency, and Ms. Snively, I don't like mandates either, but 6,300, whatever the number is, in 2 weeks, I mean, we can't turn our backs on that. We can't walk away from it. We have to do something, but I do think we need to change this order to put, I like the business side of it, but we need to put more of the responsibility on the individual, not the businesses. Thank you.
Ms. Snively, you recognize.
Thank you, Chair. And I agree with Commissioner Merman that and Commissioner Overman coming up with some type of compromise that would hold businesses harmless if they're trying without, being put into a dangerous situation. Because you do have businesses that you got a 17-year-old cashier that's running the storefront and, young adults coming in and harassing a 17-year-old, intimidating a 17-year-old, and yet they're the ones that are going to be criminally held liable for not being able to get those people to leave their establishment or put a mask on. Why is it the 17-year-old who's operating the business at the front desk responsible for trying to get, 3 burly 20-somethings out of the business so that she doesn't feel threatened or harassed or intimidated or in danger? So yes, the onus should be more on the individual, and if there's a way we can, like Commissioner Overman said, do things, allow the small businesses to communicate their requirements to the public so that if somebody does call the police or law enforcement, then the owner can say, well, I am doing my best. I've done everything that I could possibly do to enforce this, and I should not be held criminally liable for doing the best that I could do. So, but thank you for your comments, Commissioner Merman and Commissioner Overman.
Mayor Lott, you recognize.
I think this has been great discussion. I hope today that there's not a motion for us to change or to eliminate anything in the current order that we have, because every time we make changes, every time we approve something, we say it over and over again, there's unintended consequences. But I do think that from this discussion here, I would hope Ms. Beck would take these ideas and bring us back some of these we have. It looks like we're getting them pretty well narrowed down right now, so that we can see it in writing before we take action on this, whether it be Thursday or next Monday. But I do think this is great conversation. It allows us to go out and talk to our staff and our municipalities and so forth, and get more feedback. And if we can get some of that, those ideas back to us in writing from our county attorney, then maybe we can have some hard data to make a solid decision with. I would think hopefully maybe by next Monday. I think Thursday would be pushing it, but I just hope that we don't actually take action on this today. I think we have a lot more research to do. Thank you.
Commissioner Overman, you recognize.
So thank you, Mayor Lott. I agree. I don't really want us to take action on this particular idea, but I do think advising or asking Ms. Beck to come back and bring some language that incorporates the steps that Mayor Ross had and actually Mayor Lott agreed to or seemed to agree with. Put those steps in place to give business owners further proof that they are adhering to the rule. and then bring us back some language that would give the business owner a level playing field when it comes to the customer that actually refuses to follow their guidance or their recommendations as they've been posted. So if we could get some language, I'm not sure we need to change the penalties if we just level the playing field and give the business owners the tools that they need to be protected and the steps that they need to take in order to document that they are following the rules as much as they can. If that's possible.
Ms. Beck, do you following what's going on here?
Absolutely, Commissioner, and we would be happy to. This has been very helpful conversation, and we will do our best to try to incorporate it and present it to you in a way that would allow you to consider it and make possibly some future decisions. And the only thing I would remind the board is that you do need to reapprove the face covering order because the 7 days would expire today. So that is business that does need to be taken care of today. And then if you would state whether bringing this back on Monday would be acceptable, or if you prefer a different date, that would also be helpful to have that clarity.
I'll move to approve.
Whoa.
Sorry.
So we have to approve the face covering order today as it is, and then the information or the request that's been made by members for you to bring something back would not come back again until next Monday, because we did make a determination it would be every 7 days. Am I right?
That's correct. And at some point when this is settled, if you want to, direct that they travel together with the emergency order, we can certainly do that. Right now, we've been staggered because of their different start times, but I think that will follow once we get settled on the final version.
Okay. Commissioner Overman, you recognize.
So I know Mayor Ross, I'll wait to hear from Mayor Ross. He's had his hand up for a bit.
Mayor Ross, you recognize.
Thank you, Commissioner. So if I understand correctly, we passed a motion that Commissioner Merman made to add an exception, and then we launched into a discussion about paragraphs 6, 7, and 8, which we essentially tabled until Ms. Beck gets back to us. But I had another amendment that I wanted to bring up. Hopefully it's less controversial, but hard to tell. It shouldn't be. But I wanted to amend paragraph 9, section A, where it says persons under the age of 2, to make it read persons under the age of 8. And so I'll make a motion to do that.
We already did that.
When did we do that?
In my motion.
Chair Miller, may I respond?
Yeah, I was about to ask you.
So I think, Commissioner Merman, your exception, the way I understood it, was that all persons under 18, while they're engaged in a youth sport league or child care or summer camp, that they would be accepted. And I think if I understand Mayor Ross correctly, if we raise the age to 8 for other things, it would mean that only children 8 or older would have to wear a mask, for example, in a business or when they're not part of a child care or part of a child activity.
I'll support that idea.
Hold on. I'm going to get a clarification here. I heard Commissioner Ms. Beck say something. Commissioner Merman, did you respond?
No, I haven't responded yet, but I assume that my amendment took care of that issue. Basically, and if it didn't, we should have amended that Ms. Beck helped me put that motion together. She knew what the issues were. So I'll support the motion, but it should apply to everything. But
so then it would really just be anybody under 18 and doing anything. It wouldn't have to be limited to all of the
the things that were stated. So
I didn't really think I limited it to that. I just said participating, including, and then I added at the end in private, public, or nonprofit activities. But I mean, if we need to do this motion to clarify that, that's fine. Because I got the motion from you all to take care of that, but I guess it didn't cover everything.
Commissioner, can I clarify?
Yes, Mayor Ross, you recognized.
Okay, thank you. As I understood your motion, Commissioner Merman, it said persons under the age of 18 engaged in organized sports, etc. So if there's a 5-year-old who's not engaged in organized sports, they're still subject to this order. Your order said they had to be engaged in organized sports. And now the alternate is that if we could just say, well, anybody under 18 doesn't have to comply at all. Well, that's not my motion. I wouldn't have voted for your motion if I thought that's what we were doing, because 16-year-olds need to be wearing a mask.
Right.
I don't know. I guess I withdraw the motion because I didn't hear what you guys all heard. So I withdraw the motion, Commissioner.
No, can I speak?
Yes, because I'm a little confused myself right now, because I thought Commissioner Merman's motion dealt with sports, outdoor activities, and summer camps.
And childcare.
And childcare.
Yeah, it did. So just, Mayor Ross, just make your motion, and that will further clarify in the order the age requirement to wear a mask.
That's okay. I'll just pass.
Sure. Okay.
Okay. Commissioner Ullman, you recognize.
I also would not have voted on the item on Commissioner Merman's motion, but I realized it was everything. Child care is a highly regulated area, highly supported by recommendations, and we've hashed those out, since the beginning, and how they are doing what they can to keep children safe. Summer programs have gotten the same treatment, and sports programs have specific recommendations to keep people safe. Mayor Ross's idea that outside of those arenas, having someone under the age of 18 run around without a face covering, especially teenagers, where there's no requirement, is going to create a risk factor that is going to probably cause a spread among children that is going to compromise or make it very difficult to open schools in the fall. And I'd hate to see that happen. So I would, Mayor Ross, support your motion of face coverings over the age of 8. I think that, the age is, where children are very active and a little more independent. So I would support that, but I think doing nothing at this point is not really a good idea. So if you want to put that motion back up there, I'm good. I will put it forward if you're not. So but I'm interested to hear all the other members' opinion, but I think it's important for us to make it clear that young people need to be part of the solution too. And they're willing to if we work with them to help them be compliant. I'll stop there to hear input.
Mr. Snively, you recognize.
Thank you. I just have a general question. Why the age of 8? Like, is there some research from somewhere that shows that that's an appropriate age, or why the age of 8?
Mayor Ross?
I just remember what my kids were like at below 8. I mean, if we wanted to make it 10, fine. If we wanted to make it 6, fine. But I would hear the motion anyway. So as I understand it now, anybody under 18 can go without. So
the motion has been withdrawn. So Commissioner, on the hand I see right now is Commissioner Snively. You recognize.
Sorry, took it down.
I'm sorry. Hold on. Okay. Mayor Castro, you recognize.
Thank you. So now I'm confused. So we've gone everybody below 18, or is it involved in?
No, just for activities.
Sports activities. Okay, because that's the second highest increase is in 15 to 24 year olds. So make sure that that's clear. All right.
Thank you. It's sports activities, Mayor.
And childcare.
And it's already really covered through the exemption of athletic activity, exercising. So it really was already covered in the original order.
Okay, Mayor Lott, you recognize.
Thank you, Mr. Chairman. Actually, if I look at my inbox of individuals requesting help, probably more than any simple area, it's where Mayor Ross was at today with getting a little help with the young ones. Here's a parent, a mom, someone trying to handle a 3-year-old, a 4-year-old, a 5-year-old at the same time, take care of themselves, do their activities, and it's frustrating. And I've actually been witnessing it myself. So, Mayor Ross, this is your idea. I really hope you'll make the motion, okay, to put it back on the board, and I'll second it if you would, please, sir.
Mayor Ross.
Am I recognized?
Yes, sir.
Okay, thank you. I will put it back on there. I make a motion that we revise paragraph 9, section A, to read from persons under the age of 2 years, to change that to persons under the age of 8 years.
And I'll second that, please.
I have a motion by Mayor Ross, second by Mayor Lott. Is there any discussion on the motion? Mayor Castro, you recognize. Mayor Castro? Oh, okay, you moving your hand?
Mic on.
No, she's taking her hand down.
Yeah, I took my hand down. Sorry.
Okay. Mayor Lott, you want to talk about it again? Okay. We have a motion by Mayor Ross, second by Mayor Lott. See no further discussion. Please call the roll. Can I ask a question before we call the roll? Hold on. Something just came to mind. Mr. Snively, if we pass this and say we continuously will be under this order when school opens, what happens with your schools?
Well, as you recall in a previous discussion, we exempted the school district because the school district will have its own plan. So, so this would not impact it. But thank you for bringing that point.
I'm pushing 70 years old, so please bear with me.
It's okay. So I was vacillating between 8 and 10 years old because I know what my kids are like too, Mayor Ross. So I'm like, thanks.
All right, we have a motion by Mayor Ross, second by Mayor Lott. Please call the roll. Hello? Clerk, are you there?
Chairman Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Lott?
Yes.
Castor?
Yes.
Ross?
Yes.
Cronister?
Yes.
Snively?
Yes.
Motion carried 8-0.
Okay, so at this point, if I'm reading the tea leaves right, we have to approve the overall face covering order today for another week. And then we've given some directions to Ms. Beck and her staff to bring back some language next Monday concerning a number of things that we put forth out there. Mr. Overman, you recognize.
Thank you. Ms. Beck mentioned earlier that I had an outstanding item to also discuss that I just wanted to get some clarification from the group. And then it would make sense to bring it back on Monday, obviously, with whatever recommendations that we've talked about today. But previously, I had an outstanding question regarding paragraph 1, where we exclude, does not include religious organization, private clubs, or nonprofit organizations, nor does it include any location under control of the public school. Okay. So I'm trying to, we really didn't get a chance to discuss the thought process behind excluding, carte blanche, nonprofit organizations. And I'd love to get some understanding of why that exclusion occurred, because many of our nonprofit organizations are required to have enterprise services or sales or those kinds of things, and that in order to help them stay afloat. I mean, they operate just like any other business to some extent. They're just by tax status determined to be a nonprofit. And I'm not sure the virus cares about tax status. So I just would like to get a better understanding of why that was recommended. We've excluded churches and other organizations, but I'm trying to understand why nonprofits were excluded. Can someone help me there? Because I'd like to remove that exclusion if possible.
Ms. Beck, you want to address that?
Yes, Chair Miller. The original direction was to focus on businesses, and the typical definition of business is for-profit. So that was simply an answer to a question of would it include a not-for-profit, and as drafted it would not, and at that point you had the choice to include it or not to include it. That's certainly a policy decision for this board if you wanted to make the order applicable, or I guess another option would be to only make it applicable to nonprofit entities in which goods and services are offered for sale to the general public. If that was your issue, I wasn't really sure, but it's certainly something that we can bring back with some options if you would like.
Well, I didn't bring up the idea about nonprofits, so I'm just curious what people's thoughts are about why that exclusion is necessary. Anybody can help me with that? 'Cause I'd like to make a motion to strike that language out of the current order, if possible.
That's a motion by Commissioner Earlwoman. Is there a second? Is there a second?
Second. Mayor Castor, second.
Mayor Castor seconds the motion. Is there discussion? Commissioner Merman, you recognize. Commissioner Merman, you recognize.
It says that business as used herein does not include religious organizations, private clubs, or nonprofit organizations. So is, in fact, what you're saying is business does not include, you're taking out nonprofit organizations, right? Is that what you're saying?
That is correct. It would just strike that particular item. All the rest would stay the same.
So what effect would this have?
Oh, go ahead. Sorry.
Chair, may I respond?
Please.
Yes, ma'am.
So that language was added at the request of the board at the last meeting, strictly as a clarification of what was meant by businesses. If Commissioner Overman, if your intent is to require face coverings and to mandate that in the public areas, inside public areas of a not-for-profit, we would need to not only strike that, but add that, because that was simply a clarification. Nonprofits were not considered to be within the definition of a business.
Okay, so that does clarify it, but I'm still trying to understand the thought process for excluding them. I didn't think that it was necessary, but apparently it was at the time, and I'm still trying to figure out why it was. Can one of the members here give me some understanding of why?
Well, you're probably not getting an answer, Mr. Commissioner, because none of the members here were the ones that put it in there. That's why I get an answer from us.
Well, I think Mayor Ross wants to give us maybe some understanding of what his thoughts
Okay.
might be.
Mayor Ross, you recognize.
Thank you, Commissioner. Commissioner Overman, I may be wrong, but I think the original language started in the draft as houses of worship and was I don't remember exactly how it was expanded then to nonprofits. I could support your motion if you could narrow it just a little bit and talk about what Ms. Beck proposed, where the nonprofits that have business-like transactions, I would be happy with that. But I like the original exemption for the houses of worship. If we could somehow disconnect those two. Again, I think they started out as separate and it was kind of lumped in, if I remember right. If you could narrow your motion down so that it dealt with like the Goodwill stores and the South, I could support it, but could we work on that to make it a little more direct?
Yes, based on Ms. Beck's response, it is to modify the language of nonprofits that not to exclude nonprofits that are offering or sell services and products as part of their operations. Is that close enough, Christine?
Yes, I mean, so one of the language that we would probably utilize is that a not-for-profit entity in which goods or services are offered for sale to the general public would be treated as a business, essentially, if this motion passes, the way I understand it.
That's the intent of the motion.
Yep.
That's the intent. But I don't think it's clarified.
Okay, so we're obviously going to put all this together in a motion that, or order that will be approved after being reviewed next Monday. But the motion is, and I'm not going to get the language right, but the motion is to modify the order, to remove the exclusion of nonprofits that provide goods and services to the general public.
And Mayor Castro, you still second that?
Yes, I second that.
Okay. And I see your hand raised. Did you want to make a comment?
Yes, I just wanted to say that nonprofits should have been included. I agree with Commissioner Overman that they should have been included from the beginning. You're talking about entertainment venues, museums, metropolitan ministries, a number of organizations where large groups come together. So I'm in agreement for the nonprofits being included.
Okay, we have a motion by Commissioner Overman, second by Mayor Castor. Seeing no further discussion, please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Lott?
Yes.
Castor?
Did you say Castor? Yes.
Yes. Ross?
Yes.
Cronister?
Yes.
Snively?
Yes.
Motion carries 8-0.
Thank you.
Okay. Is there anything else concerning the order before I ask Ms. Beck a question? Okay. Ms. Beck, help me see where we are here. We've had some amendments to the order. So those amendments take effect today, or will they take effect on Monday of next week?
I think it could be your choice. If you want to go ahead and move forward, we can redraft the order to address the motions that carried today and have that become effective immediately, and then bring back the other items on Monday. But you do need to still make the record clear that the order is approved for another 7 days.
Right. All right. So what we've done, we've made amendments to the order today that will take effect once the order is redrafted, if we pass it for another 7 days today. And then Ms. Beck and her staff will work on the suggestions that was enumerated today. She will bring back on Monday. Is everyone clear on that? So we need a motion to extend the order until next Monday, which will be July the July the 6th. This July the 6th, with the amendments that were made to it, and then she'll bring back the other items that we discussed on Monday. Is there a motion to that?
So moved.
Motion by Commissioner Overman. Is there a second?
Second, Castor.
Second by Mayor Castor. Is there discussion? Is there discussion? Mayor Lott, you recognize.
I always like to make sure everyone knows where I stand because I don't like surprising my colleagues, okay? And at least I try not to surprise you from time to time. Obviously, I do believe in taking all the necessary steps that we need to be able to slow down, stop this, the spread of COVID-19, and for us all be responsible in our own part. I don't like mandates. I've been crystal clear with that, but also believe that we're a working body on the mandate issue and wearing masks. I was on the losing end last week. Okay, it's crystal clear. It's been all in the papers and so forth. But also recognize that if I respect democracy and so forth, that we didn't approve that just for 7 days. We approved that to be for at least a few weeks until we could see if we could move the curve in the proper direction. Okay, so even though I'm against mandates, I mean I'm 100% against mandates. I do believe and I respect the decision that was made by this board, and I want to say thanks last week when we made the decision for us to discuss this on a weekly basis, and we didn't place it where it was in perpetuity until the emergency order is gone. So I just want to be clear with everyone today. I will be voting today to extend this for another 7 days. And I think that this discussion is healthy that we had today. I'm glad with the decisions we made. The issues that we delayed till next week, I think was proper. And so I just don't want to surprise any of my colleagues with where I'm coming from or the voters out there. I'm against mandates, but I do believe in respect for the decision that was made last Monday. I want us to carry this out until we get the order accurate and also until we get the results we're looking for. Thank you very much.
Thank you, Mayor. I don't see any other hands. Is there any further discussion on the motion? Any further discussion on the motion? Ms. Snively, you recognize.
Thank you, Mr. Chair. And I just want to say that although my vote most likely will not change from last week to this week, I do appreciate the robust conversation that we have had as a group, and I do appreciate the amendments and the collaborative nature that we have had in tweaking some of the language in it. I know some of it will be further discussed and move next week or next meeting, and I just wanted to thank the group for that. So I appreciate everyone in this group and the hard work that they're doing. Thank you.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. And yes, thank you, everybody. It was a great discussion today. And I'm going to definitely vote to continue this, but to let everybody know changes are coming. And I know every business probably in Hillsborough County is watching this discussion just to see where they stand. But I think at the end of the day, we will make a very good decision to move forward so that they can run their business the best way possible and protect their customers. Thank you.
Okay. Is there any further discussion on the motion? Any further discussion on the motion? Seeing none, please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Lott?
Yes.
Castor?
Yes.
Roth?
Yes.
I'm sorry, was that a yes or a no?
Yes.
Okay. Cronister?
If you were calling Cronister, it's a no vote for me.
Okay. No for Cronister. Snively?
Also a no vote. Sorry. Thank you.
Motion carries 6-2. Sheriff Cronister and Ms. Snively voted no.
Okay. Is there anything else we need to discuss today? Anything further for us to discuss today? Seeing none, we'll be back together this coming Thursday at 1:30. If that's all we have to discuss today, everyone have a great day, and we'll talk again on Thursday, and we stand adjourned.